Yeah, we are at Athletix, Sports and Orthopedic Physical Therapy in Orland Park, and our guest, Tom Mulvey. Tom, thanks for coming on board here.
Hey, thanks for having me, Pat.
Okay, we're going to educate some people on something called runner's knee, and despite the name of it, runner's knee, it is commonly something that occurs with people who are generally active, adolescents all the way up to adults. Tell us a little bit about this and what it exactly is, Tom.
Patellofemoral pain syndrome is pain that occurs in the area of the kneecap, and it can be progressively more debilitating, but more importantly, it is definitely something that's related to the activities which with these athletes and these people that are performing.
Okay. And what are the causes of this? I know I jog a little bit, and I got some knee issues myself. But what are the main causes of this?
There are several causes. One is it can be stress that occurs to the area of the kneecap itself, a contusion, some type of a force that has occurred there. Next, it will be the weakness that occurs in the hip joint itself. It can be tightness in the retinaculum, the ligamentous tissue that's on the outside of the kneecap, tightness that can come from the iliotibial band, which a lot of runners talk about, that occurs through. It's also something that is affected by the muscle, the vastus medialis oblique, which is on the inner side of the kneecap here. A lot of young girls especially have a tendency to have an increased angle here, which we will call a Q angle. It's from the hip into the knee, and they tend to be a little bit more knock-kneed. These things are all factors that contribute to a change in the articulation, the placement of the kneecap within the joint, which then will result in pain.
Okay. And where do the athletes describe the pain generally at?
Quite often the pain can be underneath in the inferior portion of the kneecap. It can be on the lateral portion of the kneecap. It can be in the medial portion around the kneecap. It can also be underneath the kneecap.
Okay. I know it's very painful. I mean, I've been dealing with this on and off on my right knee for some time. But how is it treated?
Well, the treatment can be in several different ways. The first thing that's most important is finding out what is the cause of the problem. If it's tightness in some of the supportive tissue, that tightness needs to be addressed and treated. If what's occurring is a relation to the angle with which the knee it sits, a large Q angle, somebody that has a little bit more of a knock knee, which is someone that's female, will tend to have that. We also need to take into consideration the position of the ankle. The position of a flat foot can also help to change the position with which the knee joint sits. Most importantly, it's the activities with which these athletes are participating. Weakness in the vastus medialis oblique will end up allowing that kneecap to just sit millimeters to the side, which will then produce pain in that joint.
Okay. And are there concerns regarding training? Because kids train more now than ever.
Right. What's very important and what parents should take away from this is that with all of the activity with which these kids are participating in to try to get better, stronger, faster, we need to remember that a lot of these activities target the lateral portion of the knee. The medial portion of the knee has to be balanced if we want that kneecap to sit properly, if we want to have a decreased evidence of pain, if we want them to be able to function at their maximum. They shouldn't have pain in squatting. They shouldn't have pain going up and down stairs. That pain that these athletes are experiencing is not normal. Proper training can help to make sure that that does not happen.
Okay. All right, Tom. Thank you very much. Very informative.
Thanks for having me.